Does your child's rash mean it's strep throat? When your child has a rash, it can be concerning, especially if you are wondering if it means they have strep throat. The truth is, a rash alone does not automatically indicate strep throat. However, there is a specific type of rash called the scarlet fever rash that can occur in some children who have a strep throat infection caused by group A Streptococcus bacteria. This rash is a sign that the strep bacteria are producing toxins, leading to scarlet fever, which is related to but different from strep throat. To understand this better, let's look at strep throat itself. Strep throat is a bacterial infection caused by group A Streptococcus. It usually shows up with symptoms like a sore throat, pain when swallowing, fever, and swollen lymph nodes in the neck. Sometimes, you may also notice red, swollen tonsils that might have white patches or streaks of pus. Interestingly, a rash is not always present in cases of strep throat. Now, what about the scarlet fever rash? This rash typically appears 12 to 48 hours after the first signs of strep throat. It looks like a red, rough-textured rash that feels like sandpaper. It usually starts on the chest and tummy before spreading to other areas. The face may not be covered, but the cheeks can appear red, leaving a pale area around the mouth. On darker skin, the rash may be harder to see but can still be felt as rough bumps. Along with the rash, children with scarlet fever may show other signs. They might have a strawberry tongue, which is red and bumpy after a whitish coating peels off. You may also notice bright red skin in the creases of the underarms, elbows, and groin. This is known as pasture lines. Other symptoms can include fever, headache, nausea, and swollen neck glands. After the rash fades, skin peeling can occur. It is important to remember that not all rashes mean strep throat. Many childhood rashes are caused by viruses or other bacterial infections that are not related to strep throat. If your child has a rash but does not show other signs of strep throat, like a sore throat or fever, it is unlikely to be caused by strep bacteria. If you suspect that your child has both a rash and strep throat symptoms, it is crucial to consult a healthcare provider. They can perform a rapid strep test or throat culture to confirm if the infection is due to strep A. If strep is confirmed, antibiotics will be prescribed to treat the infection and prevent complications. The rash and other symptoms usually improve with treatment, but it may take a few weeks for skin peeling and swollen glands to fully resolve. If your child develops a rash along with a sore throat, fever, or swollen glands, it is important to seek medical advice promptly. Early diagnosis and treatment of strep throat and scarlet fever can help reduce the risk of complications, such as rheumatic fever or kidney inflammation. In summary, while a child's rash may suggest scarlet fever, which is linked to strep throat, not every rash means strep throat. The presence of a rough, sandpaper-like rash along with typical strep throat symptoms indicates scarlet fever and should be evaluated by a healthcare professional.